Good morning, Wakefield, and thank you for joining us in our weekly COVID-19 updates. It is my pleasure to be here. Steve Mayo, Town Administrator, joined by Ann Santos, our Chair of the Town Council, Superintendent of Schools Doug Lyons, Ruth Clay, our Health Agent, Jennifer McDonald, our Communications Director, as well as I see a number of citizens jumping in. And I do expect Tom Walsh, our Emergency Management Director, who's just jumping on right now, to join us. Unfortunately, today, we do have some not surprising news, but some new news for everybody that Wakefield has been placed into the higher risk category, the red category. And perhaps if we can show that map up there, Ryan, if you don't mind, real quick. You can see Wakefield circled there, and you can see that there is a sea of red. I think probably about half of the cities and towns in Massachusetts at this point are experiencing the higher category. Unfortunately, all of our neighbors, with the exception of Reading and North Reading, are all red or have been red for a while. Although Ruth, and Tom will jump in on this, as far as we can see, it isn't that there has been one super spreader event in ours or any of the other communities to speak of. It is what I would call mask fatigue. I would call Thanksgiving irresponsibility on the case of a lot of people, people going out, having a few drinks, meeting with friends, and all the things that we love to do. Believe me, the things I love to do. And unfortunately, letting our guard down. And I think the governor's been very clear of that, and we've seen that nationwide. While we're putting up maybe something that, talking about our daily case count, why don't we put up the other, the CDC, the state of Massachusetts sheet that shows Wakefield case counts over the last few weeks. Do you have that, Ryan? Look at that. Okay, our average, that's fine. Just case in point, through November 4th, Wakefield had 470 cumulative cases of COVID-19. This last week, we've jumped up to 813, so almost doubled since what we had, from November 4th on. And over the last couple of weeks, probably about 200 new cases. So I'm going to turn this over to Ruth, who can talk about this average daily case count here. And you can see where the spike is over the last few weeks, which we frankly thought would happen 2 weeks after Thanksgiving. So Ruth, do you want to jump in?
Sure. So just to give people perspective, this is over almost 6 months at this point. So the dot on the very far left on your screen is July. So it really shows very dramatically how things looked over the summer. And if you can even remember back to the summer, we did have very low case counts. Things were going well. People were outside and things were going fine. And then we hit Halloween, which is, I believe, that first big jump. And then the last couple of weeks have just been very dramatic. We're getting, 20, sometimes 25 cases new a day. So it's a very dramatic way of seeing how quickly and how dramatically our case counts are going. And the public health officials, anticipated that this is what was going to happen, and it is what is happening. And it is probably going to get worse before it gets better, because people will travel over Christmas, even though we have begged people not to. And then we'll have to adjust our graph because it's going to be off the graph at that point. So, the point of this is, as Steve said, we've, in the last little over a month, we've doubled our cases from, from the very beginning in March. So it's serious. And, people are getting infected by asymptomatic people. So people are not aware that they're positive because they don't have symptoms. And I'm glad that they're not sick. But the point is, any one of us could be positive and walking around and living our lives. So the only protection from that is minimizing our contact with other people and keeping a mask on. Because every time you encounter another person, including your family members who don't live with you, I think we all have a tendency of saying, oh, it's my son, it's my aunt, it's my mother, they're fine. Well, if they don't live with you, then no, they're not in the fine category. So you just really have to assume that anybody that you're in contact with is positive and treat them that way. Stay far away from them and keep your mask on and make sure they're wearing a mask, because there is no way for any of us to know who's positive and who's not. Now, the good news, sorry, go ahead, Steve.
I'll say thank you. I know we're going to talk about some of the good news at the end. I wanted to jump over to maybe Tom, if you wanted to add anything.
No, Ruth hit the nail on the head. It's actually what the CDC, they updated their procedures on the 4th, and it was the same thing. They're telling you, please do not travel during the holidays. And if you're going to celebrate your holidays, please do it with the people you live with. That's the only way we're going to get by this thing. Otherwise, we're going to see the next 4, 5, 6 weeks, we're going to see an unbelievable spike in numbers, and we won't be able to combat it unless you're doing the things that Ruth is saying. People just have to be vigilant. I know it's one of those things, people have been using the analogy, there's a light at the end of the tunnel, they see the vaccine coming, but it's a very long tunnel. It's going to be a long time before the average person gets that vaccine. So please, I know it's hard, but you just got to be strong and wait it out and do the right thing. The things we put out there. The town, I met with Ruth and Steve, and we back the CDC with what they're saying. We're living by. We're doing the same thing with our families. So we're asking everybody, do those requirements, do the things, what's being recommended to you. That's what I have.
Thank you, Tom. Our fabulous town council chair, Ann Santos, is on. Ann, you have any words of wisdom for us?
Very briefly, I just would really reiterate, it brings to mind my daughter's high school motto they have. It's non-CB, which means not for self, but for country, actually, but not for self. And I've changed my own ways in the last few weeks. Folks that I might have seen socially distancing 4 weeks ago, I'm not seeing anymore. But it is so prevalent. And I think we all have to make that sacrifice. And, I'll even say something, hopefully not too controversial, but as a person of deep, deep faith, I'm really frustrated when I drive by a church near my house and it is packed with cars. There is no possible way. Maybe there is, that there's good social distancing going on. So I would ask people to really think of where you're going in these next couple of months, because as Ruth said, it's being spread by asymptomatic folk, and that's putting all of us in danger. So just please be smart, and maybe readjust what you've been doing in the last few weeks. That's good luck to everyone. Happy holidays, but we have to be smart, because as Tom just said, the tunnel is a very long tunnel until we get to vaccines and really can protect everyone. Thank you.
Thank you, Ann. Doug, how are our schools doing?
Thank you, Steve. I appreciate it. Our schools are doing reasonably well. we've seen an uptick as all of our surrounding school communities have. This week, we have 10 new student cases to add to our data dashboard, and 4 new staff cases. And so that's an increase slightly over the numbers that we've had in the last few weeks. But I do feel like we've been able to just scale back and really take the necessary precautions that we've had to and have needed to remain in our hybrid model. For example, last week, we scaled back and closed a classroom for a portion of time just to make sure that everyone's safe there. We sent a correspondence last night via email, a letter to the community and to our faculty and staff, letting everyone know that with the 10 new cases, one of the 10 new student cases this week has resulted in scaling back of post-academy. And so we will continue to make those types of changes wherever necessary to keep everyone safe. And we will do that on scale. So if we need to close a classroom, we will do that. If we need to close a school, we will do that as well. But we will continue to watch the data in our community, continue to collaborate with the Board of Health, pay very close attention to our ability to contact trace, as well as our increasing numbers of people that are needing to quarantine. And so that's increasingly becoming a challenge because that affects families, students, and it affects faculty and staff as well, right? And so our faculty and staff have been doing an amazing job, and it is due to their vigilance and safety precautions that they've been creating at the school levels that have allowed us to stay open. But we're working day to day and week to week. And so that's where we're at right now. And special thanks again to the Board of Health and our nurses and our faculty and staff. So that's quick for me.
Thank you. Thank you, Doug. So with these new increases in cases and with all the other things going on, like the state, Wakefield is going to make some changes right now that will affect the public to a certain extent. But it's really to maintain all services, keep our employees protected, and to keep townspeople protected. So number one, although we've kind of already done this, there will be a lot more split shifts for our personnel, making sure that, for instance, I can't have my entire highway division of the DPW go out with COVID if they're all in at the same time, because God forbid we get a snowstorm, who's going to handle the plowing? So there are some real, not only health issues, but some practical logistical issues. Hours at Town Hall, we are going to step back a little bit. I think we called it vigilant adherence. We're going to step back with our hours. We will still be open to the public. We're open Monday through Friday, starting Monday through Friday, Monday next week, 8:30 to 12:30. So we are, shrinking those hours a little bit. We have a very robust online packages that you can certainly do most of what you want to do online. We have drop-off boxes. We have, and if you have to come to Town Hall, because you have to be here, and it's not just because you're dropping off your water bill. Send that in the mail. You can drop it off. Bless you. You can drop it off at a drop boxes. You don't need to come in and hand it to one of our clerks. We don't have to have all that contact. Please drop that off, or you can pay it online electronically too. So, but if you do have to come to Town Hall, very specifically, we will continue to take your temperature, and we will continue to get your information. Believe me, that's not because we're nosy. That's not because we really care. It is because we need to have your information in case it's contact tracing. And we will, in case something happens and we need to contact you. And also, we're going to be very much more stringent about, people going from department to department in here. Because what happens is someone has to go to the Board of Health. And then they've logged in, they're going to the Board of Health, and we know that. Along the way, they might stop off at my office to say hello, or to give me something, or to tell me something that I'm doing wrong, which is usually the case, but that's fine. But that's never logged anywhere. So God forbid something happened to me, that I got sick, or God forbid something happened to this person, they got sick, we're not going to be able to notify the people that should be notified. So we're going to be much more vigilant about that. And I have to say, overall, our town, our citizens have been really much better about contact tracing and working with our health department than other communities have. My discussions with other town managers on contact tracing is, how are you finding people yet? We're starting to find people. I don't want to find anybody. I don't care about the money. I want to make sure people are safe, and I want you to work with us and work with the health department so we can warn everybody and let them know. So that's really what we're very, very interested there. So we are going to ratchet back the hours at town hall a little bit, like I said. That'll be out there with Jen. We'll put that out, our great communications director. But we are available. We will still be here working. We're on the phone, email. We're very accessible, so please take advantage of that. Now to get on to maybe some more positive news out there. Maybe Ruth, want to talk a little bit about a Wakefield testing program that we're doing?
Sure. Thanks, Steve.
Thank you.
So the town is funding and conducting 3 days of COVID-19 testing. It will be the PCR test, and we're holding it this Sunday, 9 to 5 at the Voke. And then next weekend, Saturday and Sunday, again, 9 to 5 at the Voke. Anybody who is there at 5 p.m., 4:59, 5 p.m. will be tested. There's a pre-registration. It's not mandatory, but it is highly encouraged because it makes the paperwork more accurate and makes things go smoother and quicker, so people aren't waiting in line as long. And that link is on our website, right, Jen? Yes. And
Yep, I just popped it in the chat, and it's also wakefield.ma.us/COVID-testing.
Perfect. So as of an hour ago, yeah, about an hour and a half ago, there were 395 people signed up for Sunday. We easily have a capacity of 1,000 people, so there is plenty of capacity left for this Sunday. And if you go to the link and this weekend doesn't work for you, then you can do it the following weekend, Saturday or Sunday. This is for Wakefield residents only, so you cannot bring your relatives that live out of town. The other group that will be offered are school department employees, town employees, and Wakefield Light Department employees. So it's very specific as who can come. We will be checking IDs, and anybody over the age of 2 years and older can be tested. So it's PCR. You'll get your results through email.
Drive up only, no walking.
Oh, right. Thank you. Drive up.
You'll never leave your car.
No, you won't. And the access to Breakheart will be closed although each of those days. So hopefully that will help with traffic. And a sign, one of our electronic signs actually should be out there literally right now at the bottom of Hemlock and Farm, letting the public know that Breakheart, that entrance to Breakheart, will be closed this Sunday. So I'm trying to think, did I touch all the bases? Anybody?
Well, I think I want to thank, Ruth and Tom for putting that together. I want to thank Cataldo Ambulance, our ambulance provider, for working with us on this program here, and the vocational school for very graciously, letting us use what is basically their parking area. And they've been a great partner in the past and continue in the future. And that's a nice long queuing area away from the neighborhoods. And again, as Ruth said, please pre-register first. Not that it's going to guarantee you a time or that time, but it gives us an idea and does help us spread it out. Tom, did you want to add anything on that on the testing site?
No, that's good. You know, it's people I have a habit of trying to arrive early. If you just stick, they do have time slots. Try to stick to it. We're going to get, if you're in line, you're going to get tested. So there's no need to get in line at 7:30. You're going to be waiting still for an hour and a half till we get the thing set up. So if you could just do that, if you adhere to those little rules, I think we're fine. And it should go very smoothly.
And if I can also say to the community, because I have a feeling that some people will use it this way. Getting this test is not so you can get tested, find out that you tested negative, and then go willy-nilly off and do whatever you want to do, have a huge party and what have you. That's not what this is about. It's really to keep us safe, because even if you test negative on that test on Sunday, right? Who knows what happened, after that or what have you, or if something was incubating in you. So don't use this as an excuse. I tested negative, so now I can go party on without a mask and have a huge gathering. That's not what this is for. This is so people can be safe and well and what have you. So please don't take that as a permission slip, so to speak. Do we want to touch base on the vaccinations? Let's really be positive. That's coming down the pipe. Ruth, you probably.
Yep. Yeah. So that I have fresh off the press because I had a meeting this morning with the State Health Department that went over some of that information. So we do have a plan, and it's it's pretty available on the state's website. It's been on the news, so I think people kind of know what's going on. There's 4 phases. The very first group of people who are being given the vaccination, which, by the way, will start next week. So I know that our hospital in this area will be starting their vaccinations next week. So it's actually, after hearing about this for so long, it's here. It's actually here. And it's happening. So healthcare workers who have direct contact with people with COVID are the very first people who will be vaccinated. And it is the Pfizer vaccine that is kept super cold. And so it is healthcare workers, and even within healthcare workers, they are prioritizing depending on what kind of healthcare work you're doing, and long-term care facilities. And that is being done through the federal government has a contract with Walgreens and CVS. And those 2 companies will be vaccinating all the residents and staff of long-term care facilities. So those of you in the public who have friends or relatives at a long-term care facility, that will be happening this month, probably not next week, but before the end of this month, your friends and loved ones will be vaccinated. And again, most importantly, also the people who work there. So they're what we're calling the 1A group. And then it goes out from there, 1B being first responders, on and on and on. So the intent is to be done with phase 1 sometime in February. That's the intent. And that is purely based on how much vaccine is made available and how many kinds of vaccines are approved, because more and more will be approved over time, how much they can make, how quickly it gets to us. But that's the current thought, is we'll be through phase 1, which includes people with high risk by February or sometime in February. And then phase 2 will start in February. And again, hopefully be done by April, and then between April and June doing the rest of the population. So the whole chart is available on mass.gov. So, and we didn't get it I mean, literally, it's just been approved. So we didn't have time to get it within this presentation. So just keep checking. The health departments won't be doing clinics the way where, you know, people are used to till phase 3. So until that time, people will be getting their vaccinations through very specific means. And of course, that all has an asterisk because it all can change depending on everything, on how much vaccine, how many kinds of vaccine, how quickly people can use the vaccine and keep going. So, but the good news is we're starting. We're actually starting.
That is excellent news. Thank you. Before we go to close, does anybody else have any comments from the panel? No? I see everybody good. All right. You know, last night, Chair Santos and I were very honored to take part in the lighting of the menorah, the virtual lighting of the menorah. And the menorah is on our common. We're thrilled to have that. And it was a great ceremony put on by the Shabbat of the North Shore. And one thing that was very poignant to me was talking about how important one person's action is, how important one light is, and how that spreads. So in my mind, if each one of us can do, and I speak to the community, can do a little part, make sure you wear your mask, ratchet down a little bit, close your circle a little bit, you know, be vigilant. That'll make have a huge ripple effect and make a huge difference. So please, Wakefield, stay strong, you know, wash your hands, watch your distance, wear a mask, and really be vigilant. So again, to the community, I want to thank you for all the work you've done. I want to thank our health department, our healthcare workers, our teachers, our DPW guys, our first responders, certainly my team here at Town Hall. You guys do a fabulous job. The leadership of the Town Council and the Board of Health and School Committee in this. And everyone, stay safe, stay strong, and be really tough for the next few weeks. There is a light at the end of the tunnel, and I think Tom was right. The tunnel's a little longer than we'd like, but we got to stay strong going through it. So everyone have a nice weekend, Wakefield. Take care. Thank you.
Thank you, everybody.